Coronavirus or COVID-19 has many names and has their corresponding activation cycle. Though scientists claim 90% success of vaccines, in reality, many people are affected even after being vaccinated. It is to be mentioned that being vaccinated gives some immunity from serious sickness. So to be safe, you need to know day-to-day progression of coronavirus. What are the symptoms and how long does it take to appear? Especially after the emergence of omicron, you need to know the day-to-day symptoms of coronavirus in the body to be safe. For more videos like this, subscribe and press the bell icon for notification. Coronavirus is resurfacing in many parts of the world. The reason being, the world is partially vaccinated and many vaccines need booster dose to maintain effectiveness. Let's first check the common symptoms and critical symptoms. Common symptoms: fever and/or chills, cough, usually dry cough, shortness of breath or difficulty breathing, tiredness, aches and pains, headaches, sore throat. In case of serious complication, difficulty breathing due to lung infection and blood clots. A day-to-day progression breakdown of coronavirus symptoms. Day 1. This may occur after 3 to 20 days after exposure. A patient may feel uneasiness inside his or her body. They may sweat and feel palpitations. Consumption of cold water to alleviate this may cause faster invasion of coronavirus. Symptoms start with mild fever and cough. Depending on the patient's immunity system and the foods they consumed, there may be some sign of diarrhea too. Some patients may just have some mild cough and no fever at the start. Day 3. By the third day, everyone will show a high fever. There may be a dry cough. Coughing can be of varying severity. If the patient is having a high fever and no sign of recovery, it's time to admit the patient to a hospital. If you are having a breathing problem too, please buy an oximeter. Whenever you are having a breathing issue, check your oxygen level. If you have a low oxygen level, contact a hospital for admission. While waiting for hospital admission, you better find an oxygen cylinder for breathing assistance. Day 5. Day 5 is a true dividing line. Your present condition will indicate if you would have serious COVID complication or not. Most of the patients with coronavirus show sign of recovery within 5 days. If you are that lucky person, congratulations. You may have just passed the danger. After 7 days, a new test can ensure if you are totally COVID-free or not. But bad news if you are showing no sign of improvement. You will show a high fever and shortness of breathing. Day 7. Most affected patients will start showing shortness of breath. They will need an external oxygen supply from a cylinder or oxygen line. Some may start showing sign of improvement, but everyone needs to be in constant care as their condition can deteriorate at any time. Day 8. Patients will need intubation as their oxygen level will plummet. Most will develop severe pneumonia. Day 9. Some patients may show sign of sepsis. Day 10 and 11. If patients show no sign of improvement and instead their condition deteriorates, then doctors may need to transfer them to the ICU. For some patients, doctor may suggest some experimental injections to save patient's life. Day 12. Many patients may recover from fever and show signs of improvement. Some may show severe lung infections. Day 16. Patients may see some improvement and coughs will be very mild. Day 17 to 21. Patients have either recovered completely or passed away from complications. Very few can be saved with experimental medications. Day 27. Most will be completely recovered from COVID-19, but some may still need treatments due to lung infections. Hope it will be helpful to the least amount of people. We don't want anyone to be affected by COVID-19 anymore. Hope we conquer this disease like the flu. We will conquer this with proper vaccination and a properly maintained lifestyle.